Welcome back, everyone. I'm so delighted that you're with us on 33 Founders today because I'm here with Jake Sattelmair, the co-founder and CEO of Wellframe. Thanks so much for being with me today.
Thanks for the chance to speak with you.
Jake, I think you described it best when you say that Wellframe is a GPS for patients. In the context of an example, perhaps, can you give us an introduction to your work?
Sure, absolutely. So let me give you one example. This is actually the first implementation that we ever did. It was for patients who just had a heart attack. And in the existing system, patients have a heart attack, they're cared for in clinic, and then they're sent home. And they may get occasional visits back to the hospital to do something called cardiac rehab, which is a program meant to help support them in their recovery and kind of teach them what to do to reduce their chances of having another heart attack. So we were able to take that protocol and deliver it to patients every day on a mobile app through a simple interactive daily health checklist to really guide them around what they needed to do, to share relevant information, to give them reminders around when to take their medications, to elicit information back from them that we could share with a cardiac nurse who had real-time insight into how those patients are doing and could send mobile messages back and forth to those patients day to day to give them feedback, to give them guidance, to give them encouragement, really help the patients feel like they stayed connected, they stayed cared for on a day-to-day basis during this period of need. And then to take that cardiac nurse who otherwise would have a real hard time knowing what their patients were doing each day and to provide a new level of insight into how those patients were doing and a new channel to communicate with patients, really with the aim of kind of amplifying the impact of that one nurse and extending the reach of care to those patients in a way that was more appealing and lower friction for them. And since then, we've expanded to dozens of different clinical areas and worked with a lot of different organizations that similarly have invested in these care management resources and are thinking about how to support and engage their patients outside of their four walls, and see mobile emerging really as a critical enabler for them to be able to do that.
I think what stands out to me most about Wellframe is, like I was sharing with you just a few minutes ago, it can be as serious or as just supplemental as you need. So someone hurts their shoulder during a workout, they can contact physician, get direct insight on how to best care for themselves. Or like you said, somebody has a heart attack and really does need, like you guys have, those to-do lists, those medical reminders and check-ins, and everyone can feel like they're taken care of.
Yeah, absolutely. There are a lot of different clinical contexts or non-clinical contexts for Wellframe, and we've started in areas where patients tend to be fairly high risk and have a lot of clinical or emotional needs. So some of the programs that we've done include individuals with serious mental illness, individuals after a heart attack, individuals with chronic disease like diabetes or hypertension that are trying to manage those conditions over time. But we've also done programs for individuals that are trying to improve their lifestyle, and improve their overall wellness and reduce the risk of getting a chronic disease, where it's a different focus, right? It's a little bit less clinical in nature and more more around improving lifestyle and improving behavior patterns. So it does speak to the flexible nature of our platform, where our clinical team and others can author and implement different types of programs for different individuals with different needs, and that we don't assume it's a one size fits all. So we really work with our partnering organizations to figure out what are the needs of your patients or of your members, and how can we configure programs that really match to those needs and extend the reach of your service model, so that we're not just giving people an app on their own, but really using it as an extension of care, so that it is a connection to the kind of care that you'd get in person or over the phone, and it's more kind of contiguous with your overall healthcare experience.
That personalization, I think, is what distinguishes you guys so much. Something that shocked me was there was a nurse who was able to contact one of her patients, an older man who was on more of a restricted diet for health reasons and going to a family dinner every Wednesday. She noticed this was happening, and now every Wednesday she sends him a quick reminder saying, "Hey John, these are the things you're okay to eat tonight."
Yep.
And something as small as a food reminder makes an enormous impact.
Yeah. Yeah, we try to balance personalization with scalability. We like to say that if an organization could send that nurse home with every patient that needed help, to work with them every day, to cook that meal with them, to take their meds with them, to teach them about how to manage their condition, to go for walks, to monitor symptoms, you'd get amazing results, right? There's no doubt that that would be beneficial for the patient, but the cost of doing that is prohibitive, and the economics of that at scale really just don't make sense, except for the highest risk patients, which is not very many people. And so the goal for us with technology technology is not, we know we're never going to completely simulate that experience, but to kind of approach that experience as much as possible. And so, part of that is where things are protocolized and where they're more standard to be able to deliver, deliver best practice clinical programs and clinical protocols, but also to use that as a way of fueling a more personalized experience for the patient. So to use that information that we collect to give that nurse insight into exactly what the patient's doing and how they're doing, so they can have very targeted outreach that's very contextualized to the patient's experience. So as you indicated, noticing that the patient's consistently having, say, a weight spike on Wednesday, and then asking why, and then realizing it's because of a family meal that may include salty foods, and then being able to provide a very specific reminder for that patient, that's never going to get picked up in a generic protocol, but also might not get picked up if we didn't have that increased signal, sampling frequency by being able to get information from the patient every day. So yeah, I agree that that's kind of one example for where we can really kind of uncover some insights that help provide better care.
Your model reminds me a lot of a great insight that David Haber from Bond Street just shared with me. Very different premise. They're working on small business loans, but what he said was that to enable and maximize the human touch, they have to scale the underlying technology. And that's the same thing that you guys are working on. How has the tech evolved the last 4 years?
Yeah, a lot. So, when we started off, as you might imagine, we built the most basic version of what we could to demonstrate effectiveness. And actually, the way we did that was through a couple pilot clinical trials with academic medical centers where we actually did clinical studies and looked at impact on patient engagement and patient adherence and some proxy outcomes, as well as kind of care manager efficiency and experience. That was starting with a couple clinical programs that were very focused and very discrete. And so we've expanded a lot in terms of the breadth of programs that we're able to offer. We also continue to invest in the patient experience through our native mobile application. That's really their kind of window to their care program, as well as their way of accessing support from their care manager. We've also invested a ton in the care manager experience. So through our web dashboard, providing insights into how patients are doing, and improving workflow for the care manager to be able to reach more patients more efficiently, giving the care manager insight into which segments of patients might need attention, improving the communication channels with the patients and offering more diverse channels through which to reach patients. And then, really a big area of innovation for us is on what we do with the data that we collect. And so using that to inform, more personalized and more adaptive programs back to patients, using it to inform more insights for care managers that help them to do a better job. So, we're continuing to invest a lot in R&D and really feel like though we've come a long way, we've only scratched the surface for what we want to do longer term. So we'll continue to invest heavily in our platform and continue to learn with our partners and work closely with our partners to figure out what their needs are and make sure that we're always kind of ahead of the curve in terms of how we address them.
Great. I want to touch on two in particular parts of that response. The first one is the data, and I know over the last 4 years you guys have amassed so much, and of course the future will only bring more as we have more wearable technology. What are your plans for that data right now?
Sure. So, I guess there are a few things that are important to address here. First of all, I think there are a lot of companies that think about patients as kind of beacons of health data, right? If I can just get the data that I need from the patient, I can provide better care, or, I can understand risk, or I can better manage outcomes. We took a little bit of a different approach and we said, there isn't useful information that we can get from patients and data that would be helpful in terms of improving the kind of care that we get. But in order to make that make sense for the patient, what kind of value can we deliver to the patient first so that they have a reason to share their data? And, what we saw is for patients that are going through these windows of vulnerability, helping them to be more connected and more cared for on a day-to-day basis was really the most valuable thing that we could offer, right? More than a reward or an incentive or gamification or anything like that. So that's really what we've optimized. And as a result of that, patients feel like if I share information with my care manager, I'm going to get better care back, right? So it's more of a virtuous cycle. So as a result of that, we are able to collect a lot of information from patients. First of all, from a privacy perspective, we're very clear that we don't share that with any third parties. We don't sell their data in identifiable or de-identified format. the focus of our data is really around making the experience better for the patient, providing good insights for the clinician, helping to optimize that relationship and optimize the kind of care that the patient gets. Within that, though, there are so many opportunities for us to really help the clinician or the care manager to understand the needs of patients and to be able to reach patients in the most strategic way. And then to task shift a little bit more of what that care manager does with technology, using the data that we collect to help provide patients with automatic feedback and indicators of their progress and encouragement as they progress through a care plan. So those are a couple areas. And then, working with partners like health plans and healthcare delivery organizations, we can match up all the data that we're collecting directly from the patient with clinical data or claims data that provide a broader context of the needs of that patient. And combining those together can help us be even smarter about supporting the care manager toward offering care.
I love when I hear you describe that because every part of your work must feel so rewarding because it's helping the physicians, it's helping the patient. Just makes me want to come join so I can be a part of the part
Well,
of
you're welcome to. So
part of
we're
the great
growing. So
mission. But we'll have to
yeah.
be in San Diego. I'm not gonna live in the cold. I'll
All right,
operate
we'll,
from
we'll
here.
we'll move our headquarters next week. How about that? So.
Sounds like a plan. As you look at the future with everything that you just shared regarding that data and where you guys can go, what are your plans for the next 12 months? What are some big milestones you guys want to hit?
Sure. So we have a number of pretty big implementations coming up over the next 12 months that give us the opportunity to expand into different clinical areas that are important, but also to have our product being used at much larger scale with organizations that are providing care management or managing risk over not just hundreds or thousands of patients, but hundreds of thousands or millions of patients. And so being prepared to execute at that scale is a big focus for us right now, and then continuing to invest in the tools that care managers and patients can use to kind of collaborate to improve their outcomes is another one. And then the data that we get from those larger implementations helps us to more granularly segment different types of patients and understand what their needs are, so that ultimately we're moving in a direction where every patient on Wellframe will get a slightly different program according to their needs. And it's not just based on their clinical needs, like, oh, I have one condition or I have another, but it's based on their lifestyle needs and their preferences as well. So you can deliver the same clinical protocol to two patients in a very different way based on whether they like to get videos or articles, and whether they like to see things in the morning or in the evening, or whether they like a lot of messages or less messages, or whether they like to respond to questions or give other types of feedback. And so learning about the preferences and what will optimize engagement and value for each type of patient is a big priority for us over the next 12 months. So really making the program for me. If you're a patient, that it's not just, well, this is the standard diabetes program that my nurse gives to everyone, but this is a program that's for me, is a big area of innovation. And that really speaks to our strengths at the intersection of kind of clinical protocol or program development, engineering, and data science and consumer engagement, right? And that's a lot of things to bring together, but that's really the team that we've assembled and where we're really focused.
As you talk about that intense focus for the patient, I know that's why you guys started
Yeah.
Wellframe. From 2011 to now, what are you most proud of?
I think the thing I'm most proud of is the team that we've been able to bring together here. We started as, four folks in a garage, pretty much, and have been able to attract people that are much better than we are at a lot of different things, that have bought into the mission that we started with and are working to advance that mission in different ways. And I think being able to see such a talented group of people come together to develop our solution and bring that solution to market is something I'm most proud of, and I think is core to the success that we've had so far, and the thing that we need to continue to invest in to continue that success.
Do you miss the early days from the garage?
there are there are things about it that I miss, but I think if we stayed in the garage forever, we wouldn't have much of an impact. So I'm very encouraged that we've left the garage, or at least are in a slightly bigger garage, and hope to find a bigger garage yet.
How have you evolved personally as a leader? So, CEO Jake back in 2011 to 2015 CEO.
Um, yeah, that's a loaded question, I think. I guess I can say that I I'd done a lot of different things before this, and I've never learned as much about kind of
Oh,
myself as well as the world in general as I have per day doing this. I think
oh,
I'm
per day.
per day, yeah, every day. So, I feel like I'm constantly challenged to do things that are, as a first time entrepreneur, new to me, and constantly challenged to learn and be investing and learning ahead of what's needed for the company. And, to continue to be productive in this role, I need to keep investing in developing, my own skills and understanding to lead the company effectively. And so it's a big challenge, but it's also been really gratifying, and I think kind of pushed me to learn about things and be competent at things that I wasn't before. And it's been a lot of fun overall, but it's definitely hasn't been easy.
Lends to a great insight that Fred Wilson just shared, that you have to learn some things the hard way in order to learn them really well.
Yeah.
What are one or two things the last 4 years that have been a challenge to learn, but have just changed you as a person?
Yeah, we think about that a lot. All of us were first-time entrepreneurs when we started Wellframe, so we had the benefit of assuming that we didn't know something and realizing that we'd have to learn it as efficiently as possible. And yeah, absolutely, you're going to have to learn some things the hard way, but we said, well, let's try to find and surround ourselves by people who have learned things the hard way before. So if there are lessons that we can learn more efficiently. Let's do that, and then that'll allow us to learn more advanced lessons the hard way, not basic ones. And so we've built up a solid roster of advisors and mentors and individuals that have run companies and grown companies and had successes and had failures. And I personally have worked really hard to engage with and learn from those folks over time. And I think that's helped us identify patterns that lead to success and failure and try to follow the right ones and then adapt them to what makes sense for us as a company and as individuals and given our mission. And I think it's helped us avoid some pitfalls. But we still learn things all the time. So as an example, as we started to commercialize our platform, there are so many different groups that could potentially benefit from Wellframe that it was a little bit hard to know where to start first, right? And if you look at our early client base, it's very diverse. It ranges from a hospital to an IPA to a pharmacy to a health plan to a care management service provider. So it took us a little bit of time to figure out where we should really focus from a sales and a growth perspective. And it doesn't mean that we're not relevant for all these organizations, and we continue to work with a broad range of customers. But in terms of where we focus on our growth, we are able to qualify where the best early segments are for us and then focus our kind of sales and marketing efforts there. So those are some things that, is a new market, right? And we were kind of pushing a new way of doing things. And there was no model to say this is exactly how you should do something. We kind of had to learn by trial and error. So the goal was to make smart decisions based on what we knew and then try to learn things we didn't know as quickly as possible. And then make sure we didn't make any commitments beyond what we felt we could actually follow through on, and then work on kind of iterating on our strategy as quickly as possible.
Who are some of the mentors that have helped with that?
Um, Man, there are way too many to list here. I find that folks with operating experience are particularly helpful, who have kind of been in the shoes of an executive and have brought something from zero to greater than zero, whatever that might be, and have kind of felt the excitement and the opportunity as well as the pressure of doing that and having expectations increase as you grow. So those tend to be the folks that I look to, broadly speaking, for guidance, and especially when it comes to leadership. But there are also a lot of experts, right, that are really good at policy or technology or sales or consumer engagement or clinical protocol development or finance or whatever it might be, that we also try to surround ourselves with. And some of those now work at Wellframe, some of them are advisors to Wellframe, some of them are just people that we know in our network that are able to be helpful from time to time. So I think there are a few different tracks of advisors or mentors that we follow. And also you always meet new people. I think that different people can be helpful at different stages of an organization. And it's not always the same person that helps you throughout, right? Maybe folks that help you think about your seed round are different than folks that help you think about your Series B, for instance, right? And there's nothing wrong with that, right?
Glad you mentioned fundraising because I want to shift gears for a couple of minutes to chat about that. Despite having now raised $10 million, you've been open about the challenges of fundraising during the early days and that you brought on your early investors one by one. What was that experience like?
Yeah, well, talk about learning, right? That wasn't something any of us had done. And, at that point, it was really about, building trust and relationships, typically with folks that had been entrepreneurs themselves and probably saw in us, some similarity to their kind of passion and their persistence when they were starting off. The first folks that invest in us was more about investing in the team and our ability to figure things out as it was about any particular traction or progress in one area or the other. So that was one stage of fundraising, and as we went forward, it starts to become more about not just the team, but the product that we've developed and the market that we're selling into and our opportunity for growth and our ability to differentiate what we're doing longer term and things like that, right? And so, again, always kind of learning and trying to improve on our approach, and then different things resonate at different stages.
You shared in a past interview that when you were pitching Wellframe in the early days, an investor told you that you guys have a great team, but that it was the worst business plan he had ever heard. That's pretty rough. How'd you recover after that one?
Um, yeah, that's a good question. At the time we were just we were happy to have the meeting with them, right? And we're like, okay, well, that's good feedback. Let's keep on going. He may not get it, but we're getting there. To be honest, before we, really started or we dedicated down the path that we're on right now, we did try a lot of things, and we experimented with different approaches and thought through different business plans. And it's inevitable that some of those are going to be better than others. And, it's the most valuable thing in the world for someone to tell you honestly what they think. If people always say nice things, it's hard to be discerning and it's hard to learn, right? So it was one of the most helpful things he could have said to us, right? It's probably that wasn't what we ended up doing, and there's good reason for it. And it's an interesting concept, but I don't think it would have been a good business, and certainly helped us learn and shape our path. So I'd much rather have someone tell us that something seems like a really stupid idea than just tell us nothing and leave us guessing. And I think we're at this point where, given what we're doing right now, we look a little bit less to people like that to give us input and look more to our clients and to the market to dictate, how good of an idea something is. And at this point, it's really less about the idea and it's more about execution, right? So it's, given the idea, can you actually deliver on the promise of what this can do for patients, for clinicians, for organizations that would be our clients or our partners. And so it's it just kind of shifts the balance of risk a little bit to, is this a good idea and a good team? Can you execute on this mission, and can you deliver value for clients and grow these relationships?
I think everyone says that, startups are like cockroaches. You'll be fighting as long as you want to stay alive. And you, on that note, actually went to pitch DFJ, who was your lead investor, with, I think you had an eye infection because Emily Belton said you looked like you were just in a bar fight.
Yeah, I did. I had my eye had gotten infected a couple days before, and I'd kind of ignored it, as I do most little things at this point. And by the morning of the kind of partner presentation, it was a giant, disgusting looking red eye. And it wasn't. I mean, to be honest, I really didn't think that much of it. It just kind of said, "Oh, sorry, my eye's infected. Let's go on," or something like that. It didn't really deter too much. It wasn't like painful or anything. So, I didn't think much of it at the time. But she had remembered it at least, and maybe others had as well.
I think I would have come in with some Rocky music playing just to
Yeah,
set the stage.
you should see the other guy, I guess, is probably the right frame there. Yeah.
Before you decided to partner with the investors that you guys have right now, what were the types of questions that you were asking them to see if you wanted to have a long-term relationship?
Yeah, so first of all, we were very kind of relationship oriented from an investor perspective, and maybe that arose out of how we engaged our first investors, as you alluded to earlier. So we had standing relationships with a number of VCs and specific partners at those venture firms well ahead of our last round. So, which gave us a chance to get to know them a little bit more and gave them a chance to see us not just as kind of a point in time, but to see our longer arc and where we were headed. So that was important, I guess thinking of it as like more of a marriage than a one night stand, right? So that was important. And then, it's really about uh, partly about the fund and are they focused where we're focused, and is there kind of institutional commitment to this area, and what's their reputation in terms of working with entrepreneurs and focusing on organizations that have big picture vision where it might take more than a few months to get there. But more than that, it was really about the individual people, right? So we ended up partnering with Emily Melton at DFJ, and I think it's someone you're gonna be working with for a long time, right? If things go well, and so it's more around alignment of vision, both in terms of where we're going as a company, as well as the kind of working relationship that we envisioned and she envisioned, and so that was as important or more important than the fund, and very pleased with the mutual decision that was made, and it's been a productive partnership so far.
Great. So, Jake, I want to spend the last couple of minutes just talking about life outside of Wellframe. When you take off your CEO hat, fill in the blank. Jake
Sure.
Sattelmair is.
Yeah, right now it's pretty clear. I have a 7 week old, so
Oh, wow.
I'm a dad and a husband. I think there's not a whole. The world is pretty small right now, so it's dad, husband, and well-framed CEO. That's pretty much it. So
That's great. So exciting, very exciting summer for the family.
yes, it's definitely not been boring.
I just had a great conversation with Jason Weingarten from Yellow, and I was asking him, what's one question that you've always wanted to be asked and nobody's asked you? And he said that question was, what drives you? And I was really surprised that no one had asked him that, but he's right. We rarely touch on what makes someone get up in the morning. So for you, well, you're getting up in the middle of the night, but
Yeah, sure.
what drives you? What keeps you up at night and keeps you excited?
Yeah, I was coming from more of an academic background, and I was always, I guess, frustrated looking for where I could make the biggest impact on the world. And, given the areas that I was passionate about and the skill set that I had, and I had experimented with a lot of different things, from the nonprofit world to the NGO world to the academic route to otherwise. And I, at some point, fell in love with the idea that technology could be used to influence people's health behaviors and healthcare decision making, and could be leveraged to do that at a great scale. Recognizing that typically fails more often than it succeeds, but really fell in love with the idea that that could be an opportunity to make a big positive impact in the lives of individuals and their health. So that's really the thing that drove all of us as a founding team from the start is we see that the world is changing, and that there are some opportunities to do things that are better for patients and better for clinicians, and that that could have a huge impact on a lot of people's lives during periods of need in areas that are very, very critical for them. And we wanted to be part of the solution, and we wanted to have an impact. And so as long as we see that we're able to do that, and that we're moving in a path to impacting more and more people's lives, I think it's hard not to be motivated.
So that was Jason's question about what he hasn't been asked. What do you want to be asked that nobody's asked you before? And it could be personal, professional, athletic achievement from second grade.
Yeah, yeah, it's a good question. I mean, I may not have the one question or the exact thing, but I do think that there's a kind of romance or kind of idealization of startups and entrepreneurs, and focusing on unicorns and companies that have done had extraordinary growth. And I think I do think it's important, and I really respect your approach in talking to a diversity of individuals at different companies of different stages. Is that it's a big commitment to take on an endeavor like this, and there's a lot of a lot of cost and a lot of investment and a lot of sacrifice to do that. And I think it's good to expose people that are thinking about starting companies and thinking about pursuing this path to the realities of doing that. And it's extraordinarily gratifying, and I couldn't imagine doing anything else right now. I absolutely love it, but it definitely comes at a high cost, and there's a lot of sacrifice to do it. And I think it's good to be frank about that, and that the statistics in terms of people that turn their great idea into $1 billion company are not great, right? And so you really have to love what you're doing and embrace the journey, and feel like no matter what the outcome, it's a worthwhile effort, and that it's something that you want to do anyway. And so I think that's an area that I'd like to see people talking about more in general, just because I think it's helpful to inform folks that might listen to a podcast like this, and inform what they might decide to do. There are a lot of avenues out there to make a difference and to have an impact, and it doesn't always mean starting something necessarily.
I'm thrilled that you mentioned that, because that's really been one of my goals with 33 Founders, is to move beyond the headline. Because the headline, for example, when you guys raise capital, it just sounds so nice. I don't know any of the work that you put into it when I read the headline. So
Yep.
Our last question for today, Jake, I'd love to know if you could give everyone a fortune cookie with a saying inside that's your favorite saying or something that guides you. What would that saying be?
Yeah, well, I think as it relates to startups, and I'm sure folks around Wellframe have heard this too many times, but I typically say be humble and be persistent. There are a lot of ups and downs along the way, and you got to find a way of staying focused while you're up, and staying focused while you're down, and realizing that as good as something might be, there's going to be another round of challenges along the way, and you got to keep stay focused on the big picture. So.
I love that you said that, and I think it's the perfect way to conclude. Before we go, can you let everyone know how they can stay up to date with Wellframe? And for those in the health industry, what's the best avenue for them to get in touch with your team?
Yeah, sure. So, you can find more info about us on wellframe.com. You can follow us on Twitter at Wellframe, or you can, message us through our website or info@wellframe to get more information, and be happy to hear from you.
Perfect. Thank you so much, Jake.
All right, thanks. Have a good one.